First tonight, phase 2 of Rhode Island's vaccination rollout. Your age, health condition, and where you live playing a role in when you can get your shot. Good evening. I'm Mike Calvo.
And I'm Shannon Heggie. The Department of Health announcing today phase 2 is likely to start in just a matter of weeks. 12 News reporter Brandon Truitt was at today's briefing. He joins us live in Providence with who will get vaccinated and when. Brandon?
Well, Mike and Shannon, the state really made a decision here. There had been a lot of chatter about what jobs or industries might be included. Instead, they're opting for 3 factors that's going to carry the state forward in this vaccination process. Tonight, a better look at the long-term vaccination plan in Rhode Island.
We are overall in a good place.
During their briefing Thursday, the Department of Health laying out the 3 factors they're using to pace the vaccine rollout.
Age, high-risk conditions, and geography.
Age, they say, is the primary factor here. Those 75 and older will start getting vaccinated in days. Phase 2 officially begins in mid-February when those 65 and up are eligible.
The aims of this next phase are to protect those most at risk for hospitalizations and death from COVID-19.
The state publishing this timeline showing how these staggered start dates will work. 65 and up begin in a few weeks. Those with select health conditions will start in mid-March along with those 60 plus. Those in their 50s after that, you can find this graph on WPRI.com.
Please understand that how quickly we go depends on vaccine availability.
In terms of registration, the state offered few specifics. Statewide registration will begin when those 65 and up are eligible at the start of phase 2. It's expected most of the process will be online.
Our goal is to make this as simple for the individuals and as effective and efficient as possible.
So as for geography, right now Central Falls is the only hotspot community that is giving out vaccinations outside of those age parameters. We know that parts of Providence, North Providence, Pawtucket, and Cranston will be added to that list as well, able to do the same thing soon enough, although exact zip codes and the timeline of when that'll happen is not clear tonight. Live in Providence, Brandon Truitt, 12 News.
First tonight, we now know who will be next in line for COVID-19 vaccines in Rhode Island. I'm Shannon Heggie.
I'm Mike Calvo. The state says from here on out it will be based largely on how old you are, not your occupation.
12 News reporter Brandon Truitt breaks down what was announced at this afternoon's briefing.
Today's briefing revealed for the first time the strategy the state will be taking, laying out 3 key factors that are going to get us through the rest of the vaccination process.
We are overall in a good place and have a strong system in place.
That system expected to get its first stress tests in the coming weeks as vaccination efforts start to expand.
Who you vaccinate matters.
Rhode Island's Department of Health dropping decisive designations, choosing to move ahead by age, high-risk health conditions, and geography, not by career or industry.
Going forward, age will continue to be the primary consideration as more people become eligible for vaccine.
Dr. Nicole Alexander-Scott saying it's a strategy aiming to keep hospitalizations and deaths down, older populations contributing to both those factors at the highest rates. Here's a look at how the state sees this playing out. Adults 75 and older will start getting vaccinated in a matter of days. 65 and older will start at the end of February, while those with designated high-risk health conditions begin in mid-March, and the list goes on from there.
Please understand that how quickly we go depends on vaccine availability.
And then there's geography. Currently, Central Falls is the only hotspot community expediting doses outside of the age parameters. The state says future community-focused vaccinations will include parts of Pawtucket, Providence, North Providence, and Cranston, although a timeline and specific zip codes are not clear. As for signing up, the state says those 75 and older will get instructions from their cities and towns. Statewide registration will begin when those 65 and older are eligible, but how is less clear.
So are we going to have towns doing different ways, or is it going to be a streamlined service through you all?
We will work that out in the way that is best. I want to bring some of that detail back at a later time.
It is really unclear what registration is going to look like. We do expect most of it to be online. The state says they are working to make it as streamlined and efficient a process as they can. In Providence, Brandon Truitt, 12 News.